is we're going to bend the hip up like this. Go ahead, bend your knee. All right. So what we want to do is this. We're going to resist abduction. So he's going to push out against this hand right here. Go ahead and push out. Good. Now relax. Now I'm going to shift him further over into adduction. Go ahead and push. Relax. Now I'm going to take him the other way, and I'm going to take him out here into abduction. I'm going to resist again. Go ahead and push. And relax. Okay? So we take him and resist in 3 different positions. Straight on, resist, adduction, resist, abduction, resist. But note that we are resisting only abduction every time. We never go to this side and resist adduction. So abduction only, 3 different positions. Good? Good. All right, straight leg raise. So go ahead and bring your leg up like this. If they can't bring it up to almost 90, that means that their hip extensors are pretty tight. Okay? I have tight hip extensors. I will not be getting up to 90, just so y'all know. Okay? That's what's going to happen to some of you guys too. Your hip extensors are tight if you cannot come up that far. Got it? So your hip extensors are where? Where are they located? Okay, yes, in the back. Hip flexors are here in the front. Hip extensors in the back. That's why I wouldn't bring them up. We're stretching them. They can't make it. That's a problem. Thomas test. So, we're going to shift you down slightly. Good. Now what I want you to do is I want you to bring this leg up and grab it and pull to your chest. Okay. So, what we want to see is, and the shorts may work a little better, but what we want to see is if, when we're pulling on this leg, all right, we're watching to see if this one comes up off the table a lot. All right? Okay? So, if we're pulling here, all right, and this leg begins to come up off the table quite a bit, then we have tight hip flexors on this side. So that's what we're looking for. It's called the Thomas test. Anybody remember what the Thompson test was? Okay, gastrocnemius, right? It was the Achilles test. So this is different. This is Thomas, not Thompson. So make sure you know the difference between the two. All right, scoot back a little bit for me. Not too much. That's good. Just so that your head doesn't get on the table. Abduction, supine. So what we are going to do is, abduction is what motion? Okay. So I'm going to put my hand right up on the iliac crest up here, and all I'm going to do is I'm going to check his motion passively. I'm doing all the work. All right? So we check abduction passively. Okay? As I'm coming out, he wants to rotate outward. I don't want him to do that. Okay? We want to keep him stable. So relax and let me do all the work. I'm going to grab the ankle. I'm going to pull outward. Good. And don't start to rotate outward. Keep it stable. Make sure you tell me how many degrees of motion are allowed, because that's what's in parentheses. Got it? So make sure you tell me that. Otherwise, it points off. So abduction, grabbing here, coming across. Adduction, so now what we're going to do is we're going to come across this way. And we're still stabilizing the hip. Questions so far? Abduction, adduction, make sure you know your degrees of motion. All right. Extension. So what we're going to do is we are going to flip him over. He's going to lie prone. So now what we're going to do is we're going to check extension. How far can he come back? We're going to grab right under the knee, and you can actually put your arm around the knee like this. Go ahead and relax. Relax, relax. So that the weight of the leg is in my arm. My hand is under the top of his knee. So what I'm going to do is I'm just going to stabilize, okay, the top of the pelvis, and we're just going to lift up. Okay? And that's extension. We're going to do all this bilaterally, remember? We'll see how flexible he is. So that is extension. Cradle the lower leg in your arm, stabilize the hip, and then lift up. Okay? Go ahead and flip over for me. Have a seat, sitting up. All right, external rotation, internal rotation. You guys did these motions for your goniometer lab, right? So which way is external rotation? Which way is the foot going to move? In, okay? So now what we're going to do here is I'm going to stabilize the leg like this. We're going to take the lower leg and we are just going to rotate inward. That's hip external rotation. To go into internal rotation for the hip, stabilize the knee again, and now we're pulling outward. Okay? That's all passive. It's all you guys. He doesn't have to do anything. So, stabilize the knee, external rotation, continue to stabilize, internal rotation. Again, you must know the degrees of motion. So for all of the actions, know the motion or the degrees. All right, Trendelenburg test. Go ahead and stand up for me. So, back up a little bit. What I'm going to ask him to do now is, I'm going to ask him to just stand on one leg. Okay, go ahead and stand on the other leg. What I am looking for is this. When he stands on one leg, does that hip drop? Does it shift? Right? Remember what I said when we were talking up front earlier, Trendelenburg? This Trendelenburg test, weak gluteus medius, he stands on that leg. If it shifts out, that is a positive test. Weak gluteus medius. Good? Questions? All right, couple more tests there on the back. And I actually need you to switch compression and distraction. All right? Because you have to picture what is happening at the sacroiliac joint, or the sacroiliac joint. Remember where the sacroiliac joint is? Where the sacrum and the ilium come together in the back? So on your paper, cross out compression and write distraction, and then cross out distraction and write compression. So just switch those. Because what we are going to do is, if you look at the level of the ACES, okay, what we're going to do is, for compression, we are actually going to push down and out. Because think about what I am doing to the sacroiliac joint. I want to put pressure on it. I'm compressing it. In order to do that, I have to push the pelvis, cross your hands, push the pelvis to the outside. So we're pushing this way. All right? This is compression. All right? Because what I'm doing is I'm pushing the ACES apart, so the ACES are distracting. But in the back, the sacroiliac joint is coming together. So it's squishing together. Okay, so cross the hands, find the ACES, push apart. That is your compression, because in the back, the sacroiliac joint is getting squished. So if there is pain with that, that is a positive, because we're squishing it. Got it? So when I distract, we're going to do the opposite. So now we're going to go on the outside of the hips here. We're going to push together. When I push together, that should open up the sacroiliac joint in the back, and that should relieve his pain. Make sense? Okay. That one can be a little confusing, so make sure you think through the process. That's why I say know your structures. If you know your structures and where they're at, it's easier to remember how to do the tests. This is why anatomy is so important. All right? Any questions on the tests? No?